I was 43 years old and I was diagnosed with stage 2 colon cancer. After receiving a telephone call from my GI doctor, he had told me that he had good news for me, that it didn't appear that the tumor had spread into my liver. I asked him plain and simple, what were my chances? He told me he thought they were great. But we needed to set up a time to see a colon surgeon because I needed to have this thing removed from my colon. About a week later, I had met with my doctor, Dr. Ian Levy from the Cleveland Clinic, and he told me that he needed to go in and basically remove a 1.5-inch tumor from my colon. We set the surgery up for about 3 days later, and 3 days later I was in the operating room having my stomach open and my tumor taken out. I was in a hospital for about 6 days. Once I left the hospital, the doctor scheduled me to come back in a week later to have the staples removed and speak about aftercare. I went to see Dr. Lavery. He had told me that the type of tumor that I had, stage 2, it did not invade any of my lymph nodes, that he recommended the Oncotype DX test. Did not recommend any chemotherapy or any radiation. I told him I had never heard of the Oncotype DX test, and he basically said it was just a test to determine the likelihood of reoccurrence. And he felt that this would be my best option. I had the Oncotype DX test done, which was very simple. I sat and answered some questions. They sent out my tumor, my results, my lab results to the lab. And fortunately for me, it came back with less than 10% chance of reoccurrence. That was absolutely great news for me because then I knew that chemotherapy, radiation would not be an option. After the results came back in, it just gave me an ease of relief knowing that the tumor wasn't an aggressive tumor, that I wouldn't have to go through any further tests, any further treatments. I would just have to make sure that I stayed up with my doctor every 3 months, having my blood tests, my physicals, and maintaining my health. So for me, it was a peace of mind. The Oncotype DX gave me a peace of mind that knowing my tumor was likelihood of 10% chance of reoccurring. Does not say it won't reoccur, it won't ever come back, but it was low. And that's the direction and the path that I took, just to monitor it with blood work and to maintain my family visits to my doctor.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.